thank Shalini and the FragileX Society of India. We have had an absolutely wonderful time, and we're very impressed with your country and the quality of the physicians and scientists here. I think you have made great strides. So let me see if I can find my talk. So it is a pleasure to be here. So I'm going to introduce a little about FragileX syndrome. I'm a developmental and behavioral pediatrician, like some of you out there, and I come from the Mind Institute, which stands for Medical Investigation of Neurodevelopmental Disorders. And our focus is to find better and better treatments and eventually cures for FragileX syndrome, autism, and a variety of other neurodevelopmental disorders. Of course, I don't work alone. I work with a whole team, and we do a lot of research and a lot of clinical care for individuals with FragileX and autism. So for those of you who haven't seen FragileX patients, I want to give you a little bit of a clinical feel so that you know who to test. But I also want to point out that there are really good treatments for FragileX that are getting better and better and better. And some of the treatments are focused on reversing the neurobiological abnormalities caused by the absence of the FMR1 protein. We call that FMRP. So this is a new age of targeted treatments, not just for FragileX, but for a variety of neurodevelopmental disorders. And FragileX is leading the way. Why do we call it FragileX? Because in the olden days, like in the 1980s, even 1970s, you could identify a fragile site using a certain kind of tissue culture media, and this is where the FMR1 gene resides. And in 1991, they found it had a CGG repetitive sequence. And this protein is, of course, very important for human evolution, for advancement of cognition and improvement in synaptic connections. So everybody has this gene. It is, when mutated with too many CGG repeats, it's the leading inherited cause of intellectual disability and the leading single gene associated with autism. Overall, about 1 in 4,000 in the general population. 60% of those with FragileX syndrome have autism spectrum disorder, and 2 to 6% of those with autism have FragileX syndrome. So there's a lot of overlap, and the overlap comes from the fact that FMRP is a protein that controls the translation of hundreds of genes, and it controls the translation of at least 30% of all of the gene mutations associated with autism. So when you take out FMRP, you get dysregulation of many other pathways, and we'll talk about that in more detail. So here's a boy, a redheaded boy with FragileX syndrome. As you can see, he's showing a lot of empathy to this little baby who's crying, and that's a conundrum in FragileX in the sense that a child can show empathy and is interested in social interaction, but often, in about 60%, diagnosed with autism. And part of the reason they're diagnosed with autism is because they have sensory hyperarousal and anxiety, so they pull away from touch, they can't make consistent eye contact, they have unusual hand mannerisms, and some have more severe social deficits. But we'll talk about that in a little more detail. Let's see if I can change the slide. No, that doesn't do it. That doesn't do it.
The arrow pointing
The arrow.
Yeah, I know. I pressed the arrow pointing down. That
On the
doesn't.
screen, can you see the
On
blue
the screen.
arrow up there? Top right corner.
Oh, that's how you take the arrow.
Yeah.
Okay. So here is, in the normal population, we have this yellow region, CGG repeat. It's normally less than 45, and in evolution, actually, the repeats expanded. It produces a certain amount of messenger RNA of this gene, and then the message is translated into FMRP, and this leads to a normal phenotype. In the pre-mutation, you have 55 to 200 repeats, so an expansion here. And this actually causes excess messenger RNA, which Flor Tassoni discovered, and 2000, or actually a year before that, but it was published in 2000. And that, we know now, leads to RNA toxicity, which are the problems that pre-mutation carriers can have. So the pre-mutation is very different from the full mutation. The full mutation is more than 200 repeats and the gene methylates, and so there's no message produced in boys. There is some message from the other X in girls, but it's the absence or deficiency of the FMRP that leads to FragileX syndrome. And it's seen in all ethnic and all racial groups. So the problems that pre-mutation carriers have are from a different mechanism. They're from RNA toxicity, not from a lack of protein. So problems with aging, including FragileX associated primary ovarian insufficiency, meaning menopause before age 40. So early menopause is caused by the FragileX premutation. Full mutation individuals do not have early menopause, okay? Just premutation individuals. And also the FragileX associated tremor ataxia syndrome, which is an intention tremor. What's that? Point? Is it a point there? Don't, okay, I won't mess with it, okay. So FAXTAS is a neurodegenerative syndrome that occurs in about 40% of pre-mutation males and in about 13% of pre-mutation females, and it's a little more prevalent as you age, okay? So that does not occur in those with the full mutation. Okay, with rare exception, occasionally you'll get a full mutation patient who has elevated message because of a lack of methylation, but that's rare. And depression, anxiety, and particularly in young boys, ADHD, and in about 10% of premutation males, we see social deficits and ASD, or autism spectrum disorder. So the premutation can cause problems, but it's related to too much message and not related to too little protein. At the upper end of the premutation, close to 200, like 180, sometimes the protein can be slightly low, and that can cause some additional problems. But most individuals with FragileX syndrome are very normal looking. They can have prominent ears, but about 30% of the young kids don't. And usually young kids don't have a long face. They look very normal. So sometimes you can't depend on the physical phenotype in order to do the testing. You have to test individuals with autism or intellectual disability when you don't know the cause. This is important. This young man here has really severe obesity, and he eats all day long, and after a meal he has a lack of satiation after a meal. He could eat again after eating a whole meal. And he also has a small genitalia, and that's similar to what we see in Prader-Willi syndrome, or the 15q deletion or uniparental disomy. And so, but he doesn't have that. He has FragileX syndrome. So we call that the Prader-Willi phenotype of FragileX syndrome. And we see that in about less than 10% of individuals with FragileX syndrome. So here are two brothers, both have FragileX syndrome. This one, the obese one here, has the Prader-Willi phenotype. This one just has regular FragileX syndrome. This one, the Prader-Willi phenotype of FragileX syndrome. And so oftentimes they're misdiagnosed with Prader-Willi syndrome, but they don't have the problem at 15q. However, one of the interacting proteins with the FragileX protein is CFIP. And CFIP stands for cytoplasmic interacting FMR1 protein, and it's really important for modulating synaptic plasticity. Most of the time it's elevated, as are many other proteins in FragileX syndrome, but in the Prader-Willi phenotype this is downregulated. We don't know why, and CFIP occurs at the 15q deletion area of Prader-Willi syndrome. So there's an interesting overlap between these two disorders. But it's important to think about and identify the Prader-Willi phenotype, because a lot of the dietary interventions that you do for Prader-Willi syndrome you need to do with the Prader-Willi phenotype, and we'll also talk in more detail about metformin. So here's a family tree. Actually, these blue squares and circles here are males and females with FragileX syndrome. And up a couple of generations, there's a lot of carriers with expanding CGG repeat. And here's the great-great-grandmother, and she had years of fibromyalgia and pain problems. She actually became opioid addicted, and eventually she developed FAXTAS, or the FragileX-associated tremor ataxia, and died of that. But as you can see, FAXTAS developed in a couple of her daughters too, and then they went on and had grandchildren with FragileX syndrome. So this process of anticipation was first recognized by Stephanie Sherman, who's one of our speakers here, and it's called the Sherman paradox. Why is the risk of having a full mutation much lower here than it is down here, farther in the pedigree? So things get worse as you go through the family tree. Here's another family. This is the mother here. You can't quite see her, but she has 3 boys here with FragileX syndrome. So this one has the long face and the prominent ears. This one not so much. So sometimes you see the phenotype, the physical phenotype, and other times you don't. And she also had a daughter who's a carrier here, but then the daughter went on to have a son with FragileX syndrome. So we see multiple generations of involvement, and that's important here in India because genetic counseling is a little bit more touchy here. Like sometimes you don't want to identify a carrier in a family because of interference with arranged marriages and concern that there may be more problems if you find out the mother is the carrier. But anytime you have a child with a full mutation, the mother is always the carrier because it only gets to a full mutation when it passes through a female. Males who are carriers will pass on only the premutation to all of their daughters, but to none of their sons. And it stays as a premutation because the sperm can only handle the premutation. There's no full mutation sperm. Okay, so this is important to remember. If a man who's identified as a carrier has 8 daughters, all of the daughters will be obligate carriers, and then they are at risk to have children with a full mutation. And it's usually a 50-50 risk, although sometimes when it passes through a woman, the offspring can have a premutation, particularly if she has a lower end CGG repeat. So here we have 4 generations. These are the kids affected with FragileX full mutation, this one with autism. This is the mother here, and she's in her 30s, and she's had early ovarian failure, anxiety, neuropathy. She has also had some autoimmune problems and eventually diagnosed with lupus. And we do see autoimmune problems, particularly hypothyroidism and fibromyalgia, about 1% to 2% of multiple sclerosis or lupus. This has to do with the RNA toxicity. So here's the grandmother of the children. She has FAXTAS and FAXPOI, but normal cognition. And here is her father who has FAXTAS and he has dementia. Dementia is seen in about 50% of the males with FAXTAS and far fewer the females with FAXTAS. So you often have to think about the whole family tree, but maybe in India you think about the family tree a little less because you don't want to upset a lot of carriers in the generations. And it probably depends on the families, Some families can take it. Other families may be at higher risk for abuse towards the carrier, particularly if the carrier is a female. So the clinical features of FragileX, they usually have double jointed thumbs. It's easy to go in and out. They have hyperextensible finger joints. Here's a boy that has a long face, and I don't know if you can notice, but he has a slight strabismus here. And when we diagnosed him at 7 years of age, he already had some amblyopia. So it's good to get him to an ophthalmologist early. You know, we recommend before 4 years of age for all kids with FragileX. He chews on his clothes, and as you can see, the collar of his shirt is a little bit torn apart here from his chewing. The other thing we see is large testicles, which we call macroorchidism. The first 3 lines are about 180 individuals who do not have the FragileX mutation, so this is general population. This is testicular size in milliliters, and this is age. And the top 3 lines are about 180 males with FragileX syndrome. So most of the time, the testicle is about twice normal size, and this occurs during puberty, beginning at about 8 to 10 years, and reaching a maximal size about 16 years. But sometimes it can be very big, like this, and hernias are also quite common, again related to some of the looseness in the connective tissue. The elastin fibers are abnormal, they're fewer, and they're more broken, and this leads to soft skin and loose connective tissue. Nobody really knows why the testicles are big, and that's an area of study. Now, FragileX can occur with other disorders too, and we do see a number of people with Klinefelter, XXY, and FragileX syndrome. There may be an increase of non-disjunction in some carriers, and so this has modified his phenotype somewhat, a little more narrow eyes, and some subtle changes in his fingers, but he has both FragileX full mutation and Klinefelter's. Now, he's a little bit better off because guess what? He has another X. And it's like women, that X is producing some protein. So he does a little bit better cognitively, even though he has 2 disorders. Most of the time, if you have 2 disorders like Down syndrome and FragileX, you're in real trouble. And we've seen many with Down syndrome and FragileX, and usually they have severe autism and severe hypotonia. The main clinical feature that you see early on is hyperactivity and delayed language. Most of the boys have hyperactivity. Those that don't, they usually have attentional problems. That's true of the girls. This one a little on the hyperactive side. This is the sister of this boy. She has slightly prominent ears, but she gets into trouble not infrequently. Behavioral features can include poor eye contact, hand biting, hand flapping when they're excited, sensitivity to touch or tactile defensiveness, perseverative speech, asking the same question over and over again, or maybe having a pat phrase, you know, that they say over and over again, and then of course autism. So the emotional and neurocognitive features, I don't have the video set up here, but this is a family whose son has FragileX syndrome and severe autism, and he's in the foreground. And then the daughter here has pretty good cognitive abilities, but she presents with screaming all day long, like a continual tantrum. And I'm not going to show the video because she's just screaming. And I asked the mom, how often does this occur? And she says all day long. So they can overreact to sensory stimuli. They have enhanced cortisol release with stressors. The overreaction to sensory stimuli is an autonomic sympathetic problem, and it's related to the GABA system, or the inhibitory system, being down-regulated in FragileX, and the overactive sympathetic system leads to more anxiety. The anxiety is definitely related to autism, and they have mood instability, outbursts, and tantrum behavior. And anxiety is another very consistent feature, usually social phobia or, specific phobia like to dogs or weather or escalators is seen in the vast majority. And the black lines here represent those that meet the DSM-4 criteria. The lighter areas here is they don't meet the DSM-4 criteria because of their intellectual deficits. Like for many anxiety syndromes, they have to be cognizant that the anxiety is different from normal, and a lot of FragileX kids are not cognizant of that. But you know, a variety of problems like even selective mutism are quite common in boys and girls. So this just shows the ADOS, which is the Autism Diagnostic Observation Scale, and this was before the DSM-5, but I wanted to point out that these diamonds each represent an individual patient, so there's a huge continuum of the social and communication problems. So some are severely autistic, and others, you know, do not have autism at all, but 60% meet the criteria on the ADOS for autism. The orange is repetitive behavior. So most FragileX kids hand flap and hand bite and have repetitive behavior. So that's not so much of on a continuum, but is seen throughout. But the social deficits are definitely on a continuum. This woman, I don't think it's set up, no, the video, but this woman has a full mutation, and she's severely autistic. So she says she has unusual hand mannerisms. She communicates, but doesn't make any sense in her talking. So she's quite affected with FragileX syndrome and autism. Now, it's important to think about the sensory modulation problems which relate to the GABA disinhibition. So the GABA system, in the absence of the FragileX protein, the GABA system is dramatically downregulated. So their inhibitory system doesn't work very well. The glutamate, or the stimulatory system, is overactive, and some of the drugs that we're going to talk about in a moment will lower that. But we also want drugs that help the GABA system work better. And one of the ways we measure this is through electrodermal testing, looking at the sweat response to stimuli, and that is a sympathetic sweat response. So here in normal individuals, the vertical lines represent stimuli. After a first stimulus, you have a little sweat response, but then you habituate, and it goes down and down and down. Habituation is related to the GABA inhibitory system. But look what happens in FragileX. You don't habituate, and sometimes you escalate. And that's why they can get sometimes aggressive and overreactive. So if you start yelling, I know, just 2 minutes left, okay. So if you start yelling at a guy with FragileX, at first he is telling me he's overstimulated, okay, and he could hit me if I keep taking pictures of him. But you have to launch into a calming routine, okay? Soft voice, no yelling, no spanking, no hitting, because you're just going to overexcite them. And that's really important for caregivers and teachers and therapists to know. Same thing happens on the MRI. On functional MRI, the blue is individuals with FragileX syndrome, the red is individuals with autism or intellectual disability. The first time they look at a face, it's similar activation, but the second time they look at a face, the FragileX activate more in their brain. So looking at your eyes is too stimulating for them. It's too stimulating. The amygdala says, hey, turn it off, so they look away, okay? So that is part of the reason why they have poor eye contact. So medical issues, recurrent otitis media, we usually treat this, of course, with antibiotics and PE tubes or grommets, loose connective tissue, hyperextensible finger joints, rare joint dislocation. Occasionally we see mitral valve prolapse, not so much in childhood, but in adulthood. Seizures in 16 to 20, excuse me, 20%. And we usually treat seizures with valproate or carbamazepine or trileptal, a variety of anti-seizure medications. Hyperactivity, they do very well with stimulants, Concerta or methylphenidate, which you have here. Anxiety, we usually treat with sertraline or another SSRI or selective serotonin reuptake inhibitor. Sleep problems, usually melatonin takes care of it. Melatonin is a great antioxidant and improves synaptic connections alone, but sometimes the sleep disturbances are severe, and then we use a low dose of clonidine at bedtime. So I want to point out that seizures make autism worse. For any kind of autism you have, whether it's tuberous sclerosis, neurofibromatosis, pre-mutation autism, full mutation autism, and the reason that seizures make autism worse, or one of the reasons, comes from Tim Benke's lab, where he has an early life seizure model in rats. And these don't have the FragileX mutation, but the green represents FMRP. And when you have multiple seizures, FMRP pulls away from the synapse and the dendrite and goes to the cell body. So you dysregulate FMRP. You pull it away from the synapse. And that can occur in any individual, okay? And FMRP is the main regulator of translation all at the synapse to help create good synaptic plasticity. If you take FMRP away, you're causing big problems in any patient. So we tend to jump on seizures and treat them very early. Who to test for FragileX? Those with ID or autism, those with learning disabilities, and features of FragileX or a family history of FragileX or FragileX-associated disorders. Women with FAXPOI or fertility problems. We think that the OBGYN people should be testing for this regularly. Patients with tremor and or cerebellar ataxia who are aging, who are at risk to have FACS tests. So treatment, of course, speech and language, OT therapy. Prompt therapy is a tactile stimulation to the mouth. Special education programs, we try to mainstream them. The National FragileX Foundation at NFXF or FragileX.org has huge numbers of special education and behavioral programs and educational programs that are helpful for FragileX, and I'm sorry I don't have time to talk about it now. Stimulants, SSRIs, as we've talked about. We use a lot of Abilify, which helps with anxiety too, and risperidone, particularly if there's significant aggression. We use guanfacine or clonidine. These are alpha-2 agonists. I'm going to talk for a minute about minocycline. Lithium sometimes can be helpful for aggression. GABA agonists like ganaxolone, and we'll talk about mGluR5 antagonists, and of course genetic counseling. So I want to talk about our low-dose serotonin study because we know from PET scanning from Chugani et al. That serotonin production in young children with autism is low, particularly in the frontal part of the brain, compared to normals. So we started treating just clinically young kids with FragileX between the ages of 18 months and 4 or 5 years of age, and we found that sertraline improved the trajectory. This is with sertraline, this is without sertraline. This is done in a retrospective study for both expressive and receptive language with sertraline, without sertraline. So I thought, okay, let's do a controlled trial. And we carried out a controlled trial of almost 60 patients, and we found that those on sertraline compared to placebo had dramatic improvements in their cognitive T-score sum and visual reception, fine motor. Actually, they improved in all of this, but only some of them were statistically significant. The combined age equivalent score, fine motor, the ones that had the most improvement in expressive language, and there was a significant improvement in those that had autism together with FragileX. So now we're doing the same study, low-dose sertraline, like 2.5 milligrams in kids ages 2 to 6 with autism. So I want to put in a plug for metformin, which is a type 2 diabetes medication. It helps like the Prader-Willi syndrome and overeating and obesity in FragileX. But the animal models of FragileX, both the mouse, the knockout mouse, and the Drosophila model, show improvement in behavior and cognition and in sleep. And in fact, I've used metformin in about 20 patients, and there has been improvements in language, and we think overall cognition, so we're going to do a controlled trial. So it's amazing how it helps adolescents and adults. I just want to give you an overview because they're going to yank me off the stage here in a minute. But mGlu-R5 antagonists have all been tried. They have not been significantly helpful in the adolescent and adults, but we're launching into a study of 3 to 6-year-olds with AFQ-056. It'll be in about 14 centers throughout the U.S., combined with intensive language intervention. So we think that this medication is a cognitive enhancer, and it can help young children with FragileX. So we'll be able to report to you about that later. Lovastatin is going through a controlled trial now at the Mind Institute. And this mGlu-R5 pathway is upregulated in FragileX, and all of these medications outlined here downregulated. MMP9 is way too high in FragileX syndrome, and that interferes with synaptic connections. And minocycline, we already carried out a controlled trial, and it is efficacious in FragileX. Some families get more benefit than others, but it was significantly different. Uh-oh, Shalini's standing up, so I better move. I just want to mention new treatments. The IGF-1 analog, trofinetide, made by Neurin, had a controlled trial in FragileX that was very successful, and they'll do more trials. CBD, or cannabidiol, is the part of marijuana that is not psychotropic. And we think in the mouse model it's very helpful for FragileX syndrome. We think it'll also be helpful for carriers, for anxiety, sleep disturbances, and maybe even for FAXTAS because of pain symptoms. Suranim and bumetanide are going through trials in autism right now, but may turn out to be more helpful for FragileX. I want to say whenever you use medications, you also want to think about innovative educational programs, which we don't have much time to talk about, but programs like CogMed, which is a computer digital program for improving attention and focus and concentration. And lastly, yoga and mindfulness meditation that you guys do here in India. Guess what? That improves the GABA system. And so we recommend it for patients. I think you should do controlled trials here in India. And this is a high-functioning guy with FragileX. He's Mosaic, and he does yoga every day, and he tells me that it is unbelievably helpful to him. And I want to thank our collaborators from La Trobe University, University of Washington, University of Colorado, and all of the great people at the Mind Institute, including the team that's here. So thank you. And I didn't go too long, did I, Shalini? Okay, thank you.